In this video, we will discuss the anatomy of the skull base. More specifically, we will discuss the anatomy of the lateral skull base. Now, the base of the skull can be described anatomically as divided into three parts: anterior skull base, posterior skull base, and lateral skull base. Anterior skull base is formed by the frontal bone, the cribriform plate of the ethmoid, the lesser wings, and the body of the sphenoid. Anterior skull base forms the floor of the anterior cranial fossa. The posterior skull base is formed by the occipital bone. It is the base of the posterior cranial fossa, and the space between the anterior skull base and the posterior skull base is the lateral skull base. What are the borders of the lateral skull base? Anteriorly, lateral skull base is bordered by the anterior border of the sphenoid body together with its greater wings and the zygomatic arch. The posterior border of the lateral skull base is the occipital bone. Lateral border of lateral skull base is the squamous part and the petrous parts of the temporal bone. So if you have to describe the anatomy of the lateral skull base, you need to describe anatomy of the sphenoid bone, anatomy of the temporal bone, especially the squamous and petrous parts. Now, another thing that you need to talk about while talking about the lateral skull base is the facial nerve, especially the intratemporal course of the facial nerve. And if you want to elaborate further, you can talk about the cavernous sinus, infratemporal fossa, and pterygopalatine fossa. I have made a video talking about infratemporal fossa and pterygopalatine fossa. I believe it's titled Tale of Two Fossae, and you can check that video out. Now, before concluding the video, I want to address the areas in the body that can be approached surgically through the lateral skull base approach. These are, and it's not an extensive list, but it is quite a big list: middle ear, mastoid and associated structures, sigmoid sinus and jugular bulb, uppermost part of the internal jugular vein, middle cranial fossa, parotid gland, facial nerve, inner ear, including cochlear and vestibular nerves, petrous apex, infratemporal fossa, carotid artery, 9th, 10th, 11th and 12th cranial nerves, eustachian tube, clivus, basi-occiput, basi-sphenoid and nasopharynx. I hope this video helped you.